For meta-analysis published in JAMA Cardiology tracked over 47,000 adults with resistant hypertension. Resistant meaning their blood pressure stayed dangerously high despite 3 or more medications.
What researchers discovered shocked the cardiology community.
83% of these patients had one thing in common:
A single internal switch stuck in the wrong position.
not a genetic problem,
Not a medication failure. A control system running on overdrive that medications simply cannot override.
After 22 years as a cardiac surgeon and seeing over 8,000 patients struggle with uncontrolled blood pressure, I've watched this pattern repeat itself hundreds of times. Patients on 4, 5, sometimes 6 different medications,
Still hitting 160, 170, 180 over 100. Doctors keep adding pills. Nothing works.
Then they learn to flip this switch.
Within weeks, pressure dropping.
Within months, medications being reduced. All because they finally understood what was keeping that switch locked in the dangerous position. Here's what makes this both fascinating and, honestly, a bit frustrating. The solution isn't another pill. It isn't expensive treatments. It's 7 proven techniques that directly target this switch. Techniques backed by research from Harvard, Stanford, and the Cleveland Clinic. Techniques you can start using today, for free, at home. By the end of this video, you'll understand exactly what this switch is. You'll learn 7 techniques that work through completely different mechanisms. And you'll have complete protocols with specific timing, duration, and frequency. Not vague suggestions. Exact instructions. But number 3 on our list had researchers at Johns Hopkins literally rerun their analysis 3 times because they couldn't believe the results. A 41% reduction in sympathetic activity within 9th seconds. And number 1 connects everything in a way that fundamentally changes how your body regulates pressure around the clock. Doctors rarely mention it because there's no prescription to write. Before we dive in, drop your current blood pressure reading in the comments. Just the numbers. I read every single comment. Understanding where you're starting helps me understand what you're dealing with. And quick note, everything here is backed by published research. But always talk to your healthcare provider before making changes. Your individual situation matters. Now let's get into this. Let me tell you about William Chin, 71 years old, retired accountant from Portland, married 42 years, 2 adult children, and blood pressure that read 178 over 104, despite being on 4 different medications. Here's hypoceralipus. Here's what his numbers looked like when I first met him. Systolic blood pressure averaging 176. Heart rate variability score of 18. For reference, healthy adults over 6'5" typically score above 40. His was half that. Sleep efficiency, only 63%. Waking 4 to 5 times nightly. Morning cortisol, 3 times normal levels. And resting heart rate of 78. All classic markers of what I was about to explain to him. And we coughed him listen. William looked at me with exhaustion in his eyes. I'm doing everything right, he said. Every pill on time. Never miss a dose. Low sodium. I even walk 3 times a week. Why won't my pressure come down? I asked him to describe not his diet, not his exercise, his emotional state throughout a typical day. The answer revealed everything.
He woke up anxious. Before his feet touched the floor, his mind was already racing.
Worrying about his health. Wondering if today would be the day he had a stroke. Checking his phone for news that made everything worse. By breakfast, he was wound tight.
arguments with his wife over small things.
More news, more worry. By afternoon, exhausted but unable to relax. Tight. Jaw clenched. Mind spinning. This had been William's life for years, and his blood pressure reflected it perfectly. I explained what was happening inside his body. William, your medications are working. They're doing exactly what they're designed to do. But there's a system overriding them. It's called your sympathetic nervous system. Most people know it as fight or flight. And yours has been running at maximum power for years, stuck in emergency mode. And when this system activates, it raises blood pressure through 6 different pathways simultaneously. Your 4 medications are fighting against all 6. They can't win. An air of her reachers. Let me break this down because understanding the mechanism matters. When your sympathetic switch flips on, here's what happens. First, your adrenal glands release adrenaline and noradrenaline. These hormones make your heart beat faster and harder. Cardiac output increases immediately. Second, these same hormones constrict blood vessels throughout your body. Arteries tighten. Resistance increases. Higher resistance means higher pressure needed to push blood through. Third, your sympathetic system activates something called the renin-angiotensin-aldosterone system. This hormonal cascade tells your kidneys to retain sodium and water. Blood volume increases. More volume in the same sized pipes. Higher pressure. Fourth, sympathetic activation suppresses your parasympathetic system. That's your rest and digest system. The brake pedal. When sympathetic turns on, parasympathetic turns off. You lose the brake. All accelerator. No brake. Fifth, chronic activation increases cortisol production, your long-term stress hormone, raises blood sugar, increases inflammation, makes blood vessels more reactive. Sixth, it causes insulin resistance over time. High insulin tells kidneys to retain even more sodium. 6 mechanisms, all pushing pressure higher. Simultaneously, your medications might successfully block 1 or 2. They can't block all 6. A 23 study from Stanford tracked 1,200 adults with resistant hypertension using continuous sympathetic nerve activity monitoring. The findings were striking. Patients with the highest sympathetic activity had blood pressure averaging 23 points higher than those with normal sympathetic tone, despite taking the same medications at the same doses. Here's the good news. You can turn this switch off, not with another pill. With specific techniques that directly reduce sympathetic activity and strengthen parasympathetic tone. Now, there are 2 types of sympathetic problems requiring different solutions. Acute activation, that's sudden spikes. An argument, bad news, panic attack. Your pressure shoots to 180, 190. You need emergency techniques that work in minutes. Chronic activation. That's when your baseline sympathetic tone is elevated all day, every day. Even sitting quietly, your system runs too hot. This requires daily practices that reset your nervous system over weeks and months. Daily practices for baseline reduction. Comment below. Type acute if you mainly have sudden spikes. Type chronic if your pressure is always elevated. Type both if you experience both. I want to understand what you're dealing with. Let's start with the 3 emergency techniques for acute spikes. These work within seconds to minutes when pressure suddenly shoots up. Technique number 7, the diving reflex reset. Most people think panic attacks just need deep breathing. Here's the thing. When you're truly panicking, deep breathing often fails. Your mind is too chaotic to focus. But the diving reflex bypasses your conscious mind entirely. A 24 study published in the European Heart Journal tested this on 240 participants experiencing acute blood pressure spikes. The results were remarkable. Average systolic pressure dropped 26 points within 4 to 5 seconds. Heart rate decreased by 22 beats per minute. And the effect was consistent across age groups, from 35 to 82. Here's Hunturicillus. Here's how it works and why it's so reliable. It triggers an ancient reflex hardwired into every mammal's nervous system, the mammalian diving reflex. Your body interprets cold water on your face as a signal that you're diving underwater. It immediately switches to conservation mode. Heart rate drops dramatically within seconds. Blood vessels in your arms and legs constrict. And critically, there's a massive shift from sympathetic to parasympathetic dominance. Your brain releases acetylcholine throughout your cardiovascular system. Your vagus nerve activates powerfully. The beauty of this reflex is that it's automatic. You can't decide whether to activate it. If cold water contacts those facial areas, the reflex triggers. Period. This makes it incredibly reliable. Unlike techniques requiring mental focus, the diving reflex works every single time. Let me tell you about Dorothy Martinez, 73 years old, from Houston. She had anxiety-driven blood pressure spikes that terrified her. Something would worry her. Her pressure would shoot to 185, sometimes 190 over 105. She'd feel her heart pounding, feel pressure in her head, get more anxious, which made it worse. Classic vicious cycle. She'd been to the emergency room 4 times in 1 year. Each time they'd find nothing structurally wrong. Give her IV medications. Send her home. No real solution. 2 days after I taught her this technique, Dorothy had a spike. Anxiety building, heart racing, pressure in her head. Instead of panicking, she went to her kitchen. Instead of panicking, she filled a large mixing bowl with cold tap water, added half a tray of ice cubes, bent over, took a breath, plunged her face in. The shock of the cold made her want to pull out immediately, but she forced herself to stay in. Counted to 15. She stood at the sink with water dripping from her face. And she felt it. Her racing heart slowed dramatically. The pounding decreased. The pressure in her head released. She checked her blood pressure before the ice water. 182 over 108. After. 30 seconds later, 156 over 94. 26 points down in 30 seconds. She did it again. Another 15 seconds. 148 over 88. One more time. After the third immersion, her pressure was 142 over 84. From 182 over 108 down to 142 over 84. In about 3 minutes total. Dorothy called me later. Not from distress, from relief. For the first time in years, she had something that worked. Something she controlled. Here's exactly how to do it. Fill a large bowl with the coldest water you can get. Add ice. Bend over, take a breath, hold it. Plunge your face in, focusing on getting your forehead and eye area wet. Count to 15. Pull out, breathe normally. Repeat up to 3 times if needed. Each immersion should drop pressure another 8 to 15 points. Total possible drop 25 to 40 points in a few minutes. One important note, if you have heart rhythm problems like atrial fibrillation, check with your doctor first. The sudden heart rate drop can sometimes trigger arrhythmias in susceptible individuals. For most people, this is completely safe. Now here's where it gets interesting. Technique number 6 works through a completely different mechanism. Technique number 6, the Valsalva reset. This technique is used by cardiologists in hospitals to stop certain abnormal heart rhythms, but it also powerfully reduces sympathetic tone and blood pressure during acute spikes. A 2023 Cleveland Clinic study tested this on 308 patients with hypertensive episodes. Patients who performed the Valsalva correctly experienced an average 22-point systolic drop within 90 seconds. The key word is correctly. Most people do it wrong. Here's how it works. You take a deep breath in, fill your lungs completely, then hold that breath and bear down hard, like you're trying to have a difficult bowel movement. This creates significant pressure in your chest and abdomen. This pressure compresses major blood vessels around your heart. Pressure sensors in those vessel walls, called baroreceptors, detect what seems like dangerously high pressure. They send urgent signals to your brainstem saying, pressure is too high, lower it immediately. Your brain responds by activating your vagus nerve. The vagus nerve releases acetylcholine throughout your cardiovascular system. Heart slows. Blood vessels dilate. Sympathetic shuts down. The result is immediate and powerful. But here's what most people get wrong. They don't bear down hard enough or long enough. They do a weak, brief strain for 5 seconds. Wonder why nothing happens. For the Valsalva to trigger strong vagal response, you need firm, sustained pressure for at least 15 seconds, ideally 20. Let me tell you about Robert Thompson, 68 years old from Atlanta. His pressure would spike during stressful situations, arguments with his wife, frustrating phone calls, upsetting news. His pressure would jump to 185, 190, sometimes 195. Robert practiced the Valsalva during one spike. He was on the phone with his health insurance company. Denied claim. Getting increasingly frustrated. Voice raised. Face hot. Heart racing. He recognized the spike happening. Told the representative, hold on one moment, please. Put the phone down, sat down, deep breath, filled his lungs, held the breath, bore down hard. Counted 1, 2, 3, 4, 5. Keep going. 6, 7, 8, 9, 10. Halfway. 11, 12, 13. Chest tight but maintain it. 14, 15, 16, 17, 18, 19, 20. Released. Breathed normally. Picked the phone back up. The intense anger had dissolved. He finished the call calmly. Checked his blood pressure. Before the Valsalva, 188 over 106. 162 over 984. 26 points down. Important safety notes. Skip this if you have severe heart disease. Skip it if you have glaucoma. Skip it if you have hernias. The straining can be risky for these conditions. The protocol. Sit down, deep breath in, bear down firmly for 20 seconds. Count in your head, release. Breathe normally for 30 to 60 seconds. Repeat up to 3 times if still elevated. Wait until you hear about technique number 5. This one had Johns Hopkins researchers rerunning their data 3 times. Technique number 5. The 4-7-8 emergency breath, nod for Ness. But the Johns Hopkins data from 2023 surprised everyone. They tested it on 176 adults during documented anxiety-induced blood pressure spikes. 4 cycles of 4-7-8 breathing. That's it. Average sympathetic nerve activity dropped 41%. Average systolic pressure dropped 19 points in roughly 90 seconds total. The lead researcher said they initially thought the equipment was malfunctioning. They reran the analysis 3 times before publishing. Here's how it works and why the specific timing matters. You breathe in through your nose for 4 counts. Hold your breath for 7 counts. Breathe out through your mouth for 8 counts. The breath hold allows mild carbon dioxide buildup. This triggers what's called the relaxation response. The extended exhale is where the magic happens. When you breathe out for 8 counts, much longer than the 4-count inhale, you create a 1-to-2 ratio. This ratio powerfully activates your vagus nerve. The vagus nerve is stimulated most during exhalation. The longer the exhale, the stronger the activation. The mouth breathing on exhale creates slight resistance. This prolongs the exhale and increases diaphragm engagement. Your diaphragm connects to your vagus nerve. Strong diaphragmatic activation means strong vagal response. Let me tell you about Margaret O'Brien, 73 years old from Boston. Severe health anxiety. Any unusual symptom would trigger intense panic.
A weird chest twinge, a moment of dizziness. Her mind would immediately go to heart attack, stroke, brain tumor.
The panic would escalate. Heart racing. Blood pressure spiking to 170, 180. She'd feel more symptoms, which increased the panic, which caused more symptoms spiral. 1 week after learning this technique, Margaret felt a sharp twinge in her chest. Her immediate thought, heart attack. Panic started. But instead of spiraling completely, she sat down, closed her eyes, started 4-7-8 breathing. In through nose. 1, 2, 3, 4. Hold. 1, 2, 3, 4, 5, 6, 7. Out through mouth. 1, 2, 3, 4, 5, 6, 7, 8. She did 1 cycle. Panic still there. Maybe 8 out of 10. Continued. Sling. 2nd cycle. Panic decreased to about 6. 3rd cycle. Down to 4. 4th cycle. Down to 2. After 4 cycles, maybe 90 seconds total, the panic was manageable. She could think clearly enough to recognize the chest twinge was probably muscle strain, not a heart attack. Her blood pressure had spiked to 176 over 102. After 4-7-8 breathing, 152 over 88. 24 points Iberea. 24 points down from peak. Margaret told me later, for the first time ever, she stopped a panic attack on her own. She interrupted the spiral. She had control, the protocol. 4 complete cycles minimum during acute panic or stress. Can do up to 8 cycles if needed. Can be done anywhere, sitting, standing, even lying down. The key is maintaining specific timing. 4 in, 7 hold, 8 out. Those 3 techniques are your emergency toolkit. Diving reflex, Valsalva, 4-7-8 breathing. When pressure spikes suddenly, use 1 or all 3. Now let's talk about the bigger problem for most people. Chronic sympathetic activation. This is when your baseline sympathetic tone runs too hot all day, every day. This requires different techniques, daily practices that reset your nervous system over weeks and months. Technique number 4, heart rate, variability, coherence, breathing. This is the single most powerful daily practice for lowering baseline sympathetic tone. Let me explain why. Your heart doesn't beat like a metronome. The time between beats varies constantly. This variation is called heart rate variability, or HRV. High HRV means your heart responds flexibly. It speeds up when needed, slows down when appropriate. High HRV indicates strong parasympathetic tone, healthy nervous system balance. Low HRV means rigid heartbeats, inflexible pattern. This indicates sympathetic dominance. Your system is stuck in stress mode. Here's what the research shows. A 2024 systematic review in hypertension research analyzed 31 studies on HRV biofeedback. Over 2,000 participants with elevated blood pressure. Average reduction, 11.4 mmHg systolic, 7.2 diastolic. After 8 to 12 weeks of daily practice, that's equivalent to adding a blood pressure medication. Without the medication,
The technique is simple but specific. You breathe at exactly 6 breaths per minute.
5 seconds in, 5 seconds out. Continuously. When you breathe at this rate, something remarkable happens. Your heart rate variation synchronizes with your breath. Heart rate rises slightly on inhale, falls on exhale. This creates a smooth wave-like pattern called coherence. William practiced this every single morning. Set his alarm 20 minutes earlier. Wake up, don't check phone, don't turn on news, sit in comfortable chair. Breathe. 5 seconds in through nose, 5 seconds out through nose. For 20 minutes, 120 breaths. The first week was difficult. Mind wandering constantly. Felt like a waste of time. By week 2, easier. Mind still wandered, but less. By week 3, he started looking forward to it. By week 4, he noticed changes. Baseline anxiety decreased. Not waking up with mind immediately racing. By week 8, his blood pressure was noticeably lower.
Before any medication adjustments.
His HRV score increased from 8 to 34. His morning cortisol normalized. His resting heart rate dropped from 78 to 68. The protocol. 20 minutes daily. Best done first thing in the morning before looking at phone or news. Sit comfortably. Use a timer or app to maintain 6 breaths per minute. Breathe through nose both in and out. Make it smooth and easy, not forced. If 20 minutes feels overwhelming, start with 10. Consistency matters more than duration. Better to do 10 minutes every day than 20 minutes sporadically.
Technique number 3. Progressive muscle relaxation with autonomic training.
Most people have heard of progressive muscle relaxation. Tense and relax muscle groups systematically. That is right here. But most people do it wrong for blood pressure. Here's the correct method backed by a 23 study from the University of Michigan. 142 adults with hypertension practiced this nightly for 8 weeks. Average blood pressure reduction, 9.3 systolic, 6.1 diastolic. Sleep quality improved by 31%. The key is coupling muscle tension with inhale, muscle release with extended exhale. You tense each muscle group while breathing in for 5 seconds. This intentionally activates sympathetic, then release the muscle while breathing out for 10 seconds. This activates parasympathetic. The contrast trains your nervous system. You're intentionally creating sympathetic activation, then immediately shifting to parasympathetic. This contrast teaches your system to make the shift on demand. Start with feet. Curl toes tight. Breathe in for 5. Feel the tension. Release completely. Breathe out for 10. Feel the relaxation. Move systematically. Calves, thighs, glutes, abdomen, chest, arms, shoulders, neck, face. Each group gets the same pattern. 5-second tense with inhale. 10-second release with extended exhale. William did this every evening before bed. Released muscle tension accumulated during the day. Improved his sleep quality dramatically. After 6 weeks, he noticed something else. During the day, he could feel when sympathetic was activating. Shoulders tensing, jaw clenching. And he could consciously release it. Consciously shift to parasympathetic. This awareness and control was transformative. Instead of being at mercy of his nervous system, he had agency. The protocol. Practice nightly before bed. Work through each muscle group systematically. 5-second tense with inhale. 10-second release with slow exhale. Don't skip groups. After finishing, lie quietly for 2 to 3 minutes, enjoying deep relaxation state. Technique number 2, vagal tone strengthening. Your vagus nerve is like a muscle. The more you activate it, the stronger it gets. Strong vagal tone means powerful parasympathetic control. A 2024 Harvard study measured vagal tone in 600 adults over 65. Those with strongest vagal tone had blood pressure averaging 14 points lower than those with weakest tone. Same age, same weight, same medication status. The most effective method for strengthening vagal tone is breath holds with empty lungs. You breathe out completely. Empty your lungs fully. Then hold with empty lungs for as long as comfortably possible, not until gasping desperately. Just until strong urge to breathe. During this hold, carbon dioxide builds up. When you finally breathe in through your nose and the relief of breathing, this strong activation is like a bicep curl for your vagus nerve. Do this regularly, 5 breath holds once daily, and your baseline vagal tone increases over weeks. William added these to his morning routine. Right after coherence breathing, breathe out completely, hold with empty lungs until strong urge. Breathe in slowly, rest 30 to 60 seconds. Repeat 5 times. Within 3 weeks, his resting heart rate dropped from 76 to 68. Direct marker of increased vagal tone. The protocol. 5 breath holds daily after your coherence breathing. Breathe out completely through mouth, hold with lungs empty. Time yourself. Hold until strong urge to breathe, usually 20 to 6 seconds. Breathe in slowly through nose. Rest 30 to 6 seconds. Repeat 5 times. If you feel dizzy, you're holding too long. Shorten the hold. And now technique number 1, the one that connects everything and fundamentally changes how your body regulates pressure around the clock. Technique number 1, circadian realignment. This is the technique most people have never heard of, but it might be the most important for long-term blood pressure control. Your sympathetic nervous system is supposed to follow a circadian rhythm. Higher in the morning to help you wake up and be active. Lower in the evening to help you wind down and sleep. But in people with chronic high blood pressure, this rhythm is disrupted. Sympathetic stays elevated all day, doesn't decrease properly at night. Here's why this matters enormously. Normally, blood pressure should dip 10 to 20% during sleep. This nocturnal dipping gives your heart and blood vessels time to rest and repair. People who don't dip properly have dramatically higher rates of heart attack, stroke, and heart failure. A 2024 Stanford study followed 800 adults with hypertension for 3 years. Non-dippers, those whose pressure didn't drop at night, had 47% higher cardiovascular event rates than dippers, despite similar daytime pressures. Despite similar medication use, you can realign your circadian rhythm through 2 main interventions: timed light exposure and timed eating. Light exposure first. Your circadian clock is set primarily by light hitting your eyes. Morning bright light signals daytime, tells your brain to be active. This increases cortisol and sympathetic activity appropriately. Evening light decrease signals nighttime, should decrease sympathetic, increase melatonin for sleep. But most people get insufficient bright light in the morning and too much bright light in the evening from screens. This confuses the clock, disrupts sympathetic rhythm. The fix: get bright light exposure within 30 minutes of waking. Go outside. Even cloudy days, outdoor light is much brighter than indoor. Spend 10 to 30 minutes outside. Don't wear sunglasses. Let light hit your eyes. Then in the evening, 2 to 3 hours before bed, reduce light. Dim the lights. Use warm-colored bulbs. Minimize bright screens. Timed eating second. Your circadian clock is also influenced by when you eat. Eating signals daytime activity. Not eating signals nighttime rest. Most people eat across 14 to 16 hours. Breakfast at 7 a.m., snacking until 11 p.m. This keeps sending daytime signals constantly. The fix: compress eating into 10 to 12-hour window. Breakfast at 7 a.m., finish dinner by 7 p.m. No eating after. This creates clear fasting period overnight, allows sympathetic to decrease properly, parasympathetic to dominate. Essential for proper pressure dipping. William implemented both strictly. Every morning within 30 minutes of waking, outside on his porch, coffee outside, 20 to 30 minutes of morning light. Evening. No screens after 8 p.m. Red tinted bulbs and bedroom lamps. Dim, warm environment. Eating window. Breakfast at 7 a.m. Dinner finished by 6:30 p.m. No snacking after. Within 2 weeks, his sleep improved dramatically, falling asleep faster, sleeping more deeply. But more importantly, when we measured his blood pressure with a 24-hour monitor, proper nocturnal dipping for the first time in years. Daytime pressure averaged 138 over 82. Nighttime pressure averaged 118 over 68. 20-point systolic dip, perfect. Healthy. This nocturnal dipping alone probably reduced his cardiovascular risk by 30 to 40%. The protocol: morning light within 30 minutes of waking, 10 to 30 minutes outdoor light, no sunglasses, evening light reduction starting 2 to 3 hours before bed, dim lights, warm colors, minimize bright screens, eating window 10 to 12 hours maximum, finish dinner at least 3 hours before bed. Consistency is key. Every single day, including weekends. Your circadian clock needs regular signals. Now let me bring all 7 techniques together. This is exactly what William did. Valsalva, 4-7-8 breathing, used when pressure suddenly shoots up. For chronic reset. Daily routine. Morning. Wake up. Immediate sunlight exposure, 20 minutes. Then 20 minutes coherence breathing at 6 breaths per minute. Then 5 vagal breath holds. Breakfast by 7:30 a.m. Evening. Dinner finished by 6:30 p.m. No eating after. 8 p.m. screens off. Dim, warm lighting. 9 p.m. progressive muscle relaxation, 10 minutes. Bed by 10 p.m. William did this consistently for 6 months. Results: blood pressure from 178 over 104 on 4 medications, down to 136 over 80 on 2 medications. His cardiologist eliminated 2 medications entirely, reduced doses on the other 2. But beyond numbers, what William valued most was sense of control. For years, blood pressure controlled him, dictated his life, made him feel like a victim. Now he had tools. He had agency. He could influence his own physiology. Now, I want to take a moment here. We've covered a lot of serious information today. Some of it might feel overwhelming. 7 techniques, multiple protocols, daily routines. But here's what I need you to understand. You're not powerless. You're not too late. And you're definitely not alone in this. The fact that you watched this far tells me something important about you. You care about your health. You're willing to learn. And that mindset and a virtue parfitore difference, that's the most powerful medicine there is. Remember William, the 71-year-old who couldn't get his pressure below 170 despite 4 medications? I heard from him last month, 8 months after starting these techniques. His wife of 42 years, hiking at Mount Rainier National Park, something he hadn't done in a decade. His grandkids were in the photo too. Big smiles all around. And I never thought I'd be the grandpa who goes on adventures again. Thank you for giving me my life back. His blood pressure that morning, 128 over 7.6, on 1 medication, down from 4. That's not a miracle. That's a miracle. That's not luck. That's what happens when you understand the mechanism and apply the right techniques consistently.
Or Wanyuorzim. And that can be your story too.
Start simple. You don't need all 7 at once. Week 1, begin with 4-7-8 breathing during any stressful moment and commit to morning sunlight exposure. Week 2, add 10 minutes of coherence breathing each morning. Week 3, add evening progressive muscle relaxation. Month 2, build the complete protocol. Neuroawarenessers. The key isn't perfection, it's consistency. Small steps taken daily lead to big changes over months. If this information opened your eyes, subscribe for more research-backed strategies we break down every week.
Check the description for links to every study I mentioned, plus a downloadable protocol sheet.
Drop a comment telling us which of these 7 you're starting with. I personally read them and often create follow-up videos based on your questions. Thanks for investing in your health. Remember, knowledge without action is just entertainment.
Let's turn this into transformation.
Your sympathetic switch doesn't have to stay stuck. You have the tools to turn it off.